Um, yeah, got it. Yeah, so I'm Yusuf, the chairman of the Alumni Association for the past 1 year. I'm also a medical doctor, currently working in the NHS. I'm in Northern Ireland, Belfast. Uh, I have with me a colleague of mine who is a doctor also in the US, in Leicester. He's in Leicester, in England. He will be taking us through a pathway that we all used in order to get our practicing license and get a job in the NHS. It'll basically take us through the kind of exams that you have to do as a Kenyan doctor to become a doctor in the UK, and we'll talk about a little bit about the opportunities in terms of training, specialization, and the other opportunities that you can get as a doctor in the UK, and any other question that you might like to ask us, we'll be willing and we'll be happy to respond. So let me just introduce Dr. Abishakur to introduce himself before we start officially.
Hi, everyone. Thank you, Dr. Yusuf, and thank you, everyone, for this opportunity. I'm not sure if you're happy for me to start without showing, like, without visual images, like showing
It's
my
okay,
face as a video.
No problem. No problem.
You guys
Yeah.
are happy like this? Let me know.
Yeah, it's fine.
That's fine. Okay. So yeah, my name is Abishakur Mohammed. I'm an internal medicine trainee at Leicester Royal Infirmary. It's a tertiary center. And the main trust name is University Hospital Leicester, which they have like 3 trusts, and one of the trusts' name is Leicester Royal Infirmary, and I work there as a trainee. I came to the United Kingdom in 2020 October, and it's been almost 3 years now. Yeah, so I've been asked to give this talk to my colleagues in Kenya who are interested to come to the United Kingdom and to work as a doctor here. Yeah, so I'm not sure if should I start, or we're still waiting for other people to join.
Well, I mean, it's just, I think you can start because either way there will be a recording and we'll be sharing this presentation.
Perfect. Okay. Yeah. So maybe before I start, I just wanted to know my audience. If you can drop a chat, just a brief, just saying if you are a doctor, or like if you're a medical student or a consultant or a registrar, just comment in the chat if you're a medical officer or a student or a consultant, so that I can address my talk as appropriate here. So I will appreciate that if you're a medical student, maybe you can write which year you are. Thank you very much. Okay, so we've got medical doctors, we've got second year medical student, 5th year medical student. Thank you, everyone. Medical student, 5th year. So we've got a few numbers of 5th year medical students. That's wonderful. Okay, so I've got a therapist 3rd year. Okay. Okay, so basically, my talk will be focused on one of the pathways to become, or to get a license to work as a doctor in the United Kingdom. So one of the pathways is plab pathway. I'm not sure if you guys are familiar with this pathway, but I'll try to make an introduction just briefly to tell you more about this plab pathway. There are other pathways like MRCP pathways, or Royal College or membership exams pathway, like MRCP, MRCS, MRPsych. So those are other pathways that you can come and as a doctor in the United Kingdom. But the easiest pathway and a less expensive pathway is plab pathway, and that's the one my colleague Yusuf and I we opted for. So my screen wider. Okay. So plab, it stands for the Professional and Linguistic Assessments Board Test. It helps the GMC to make sure doctors who qualified abroad have the right knowledge and skills to practice medicine in the United Kingdom. So basically, GMC is just like KMPDB back home. They regulate doctors, they give them license. And this GMC, they came up with this exam for international medical graduates to sit for, so that they will be equivalent to their medical graduates here in the United Kingdom. So basically, it's just to assess foreign doctors to make sure that they are safe doctors when they come and work in the UK. So there are two parts of this exam. We have part 1 and part 2 exam. So part 1 is basically more of knowledge questions. It's a multiple choice exam, almost 180 questions. It's the best of answer questions. Part 2 is more of an OSCE question. And you need to pass both parts before you can apply for registration with a license to practice in the United Kingdom. So step 1, so what are you supposed to do before you start this pathway? So the first thing you're supposed to do is you must have qualified, like you must have graduated medical school. You must have your primary medical qualification before you start this pathway. You cannot start a plab pathway while you are in, you're still studying medicine. But you can start preparing while you're still in medical school. So for example, you can start studying for plab 1 exam because it's just a very basic exam. You can start preparing for language tests while you're still in medical school. So let it not stop you from start preparing while you're still in medical school. If you have an aim or if you have a goal to come and practice in the United Kingdom as a doctor, then I will strongly advise you to start studying maybe while you're in final medical school or final year. So the first step is for you to graduate, for you to have your primary medical qualifications. The second step, which is not must, but it's strongly, I would like, it's something which is quite important that some people don't really appreciate it. So if you complete your internship and you have completed your plab exam, you will get full GMC registration. So there are two types of registration. There's full GMC registration and there's provisional GMC registration. So provisional GMC registration means when you come here, you will start working as an intern. And that's quite a tough way to come to work here as a doctor, because the GMC will want you to do more exams, or to sit for more exams or more assessment. But if you do internship, 1 year internship in Kenya, which I did that, or even Yusuf did it. So if you complete your internship in Kenya and you do plab exam, then you will get full GMC registration. That means when you come here, directly you start working as a medical officer instead of you working as an intern. Because if you come here to work as an intern, your payment will be less. You'll like the working condition is not quite favorable compared to if you come here to work as an SHO or a senior house officer. So anyways, so I will strongly advise you to make sure that you've completed your internship when you finish your plab exams, or before you start even your GMC registration process. For you to sit for language exam, which is IELTS or OET. Please just, if you have any question, you can just send it in the chat box. And Yusuf, if you can maybe manage the chat box, if you see anyone asking question, please let me know. So one of the requirements before you start all this process of plab 1 and plab 2 exam, you must do an IELTS exam or an OET exam. So the difference between IELTS and OET is that OET is more of a medical English exam. So there are medical terms used, maybe history taking. If for example, so OET or IELTS exam, they're quite similar in terms of the modules. So they have speaking modules, both of them. They have written or writing, they have reading, and they have listening. For example, OET, the medical English exam, in listening part, they can give you maybe history taking, and you just listen to the listening to the dialogue between a doctor and patient, and then from that dialogue they will be asking you questions. So it's quite easier for you to do OET exam, but it's more expensive than IELTS exam. So when you do IELTS, the required score is you must get 7.5 overall score, and minimum of 7 in all the modules. So if you get 6.5 in one of the modules and you get a total marks or total score of IELTS maybe 8, you'll fail the exam. So, or you'll not be qualified to do or to sit for plab 1 exam. So your overall score should be more than 7.5, and minimum score in each and every module should be 7. OET exam, almost similar, but they use the ABC score. So the required score is B in all 4 subsets and also overall. So you must get B or more than B in each and every module. I hope that's clear. So, and we have different type of IELTS exam. We've got general exam, and we have the academic IELTS exam. So, for you to sit for plab exam, you must do IELTS academic exam, which is more expensive than general exam and more, like I would say, more difficult than general exam, because general exam, it can be sat by anyone, but academic exam is for the professionals, maybe students or medical doctors, nurses. That's why it's called academic exam. So for you to do plab exam, you must go academic IELTS exam. So reading the 3 passages that will be given, and there will be 40 questions which has to be answered in 60 minutes. I'm not sure if they have changed that, but you can look on the official site just to make sure that they're still doing that. So listening, there will be conversations, lectures between 2 people, like a dialogue, and you just listen to what they're saying at the same time while you're listening. So speaking, this will be conducted on a separate. Examiners will be asked, the examiner will ask you a variety of questions. They might ask you to talk for 2 essays should be given. So one thing they ask you to report off the graph, talk about what you can see. And another one is the based topic view. Quite more than 8 hours. So test centers, you can do it in Nairobi, Mombasa, Eldoret. At the moment, I think it's almost 31,000. I think that all time I had, I think, a couple ago, talking about studies OET in Kenya. I'm not sure if it has been done, so you can go to the official site of OET, and I think you'll be able to find out from there. So if you have money and you just want to pass this exam very easily, then I would advise you to do OET because it's something which, like, every one of us maybe knows about it. So history taking, and they will give you, like in reading, they might give you a story about CT images or how CT was engineered or how CT was manufactured. So those type of things. So they will talk about MRI. So it's a topic that we are familiar with, rather than you being asked to talk about infrastructure, environment, and those kind of things. So OET is much easier, but it's a little bit expensive. So step 4, there's something called EPIC verification, which basically they just want to find out that the medical school you've graduated from, they teach you in a standard way, like it's a medical school which is recognized. So when you graduate, for example, from Adobe University, you need to send your certificate to this team. They're called EPIC or ECPMG, that's Educational Content. It's a non-profitable organization in the United Kingdom, and they will verify your certificate that this is an original certificate, and the method form, it's a recognized medical school. So this is one of the steps. You can do this step immediately after you graduate, because some people make mistakes. They do IELTS, their IELTS exam, they pass their plab 1, and this it's not like it's okay, but sometimes it might take time. Process of GMC registration. But if you do it even at the end, so it required so the best advice you team, and then a small amount of fees you're supposed to pay, and then when you get it verified, that's it. You don't have to do it again. It's only once, and that, yeah. Okay. Let's talk about plab 1 now. So plab exam is a professional linguistic assessment board exam. It's exam to get licensed to practice in the United Kingdom. The exam tests your ability to apply your knowledge for the care of patients. It doesn't test how well you can remember and recite facts. So questions relate to current best practice in the United Kingdom and equipment routinely available in the UK hospitals. You'll need to answer the questions in relation to published evidence and not according to your local arrangements. So it's a basic exam. It's not a subspecialized or specialized exam. So it's something that mostly fifth year or final year medical students are being taught. So they just want to know you're a safe doctor. And most of the questions, they are just emergency questions, like for example, I'll give you an example of a plab 1 question, but it just wants it tests you basic questions to find out if you're a safe doctor. That's all. Yeah. So the available exam dates and centers can only be seen through the GMC online account. The subsequent booking and registration application has to be done through your GMC account. So let's say you've passed your IELTS exam. After you pass your IELTS exam, you go to the GMC website, you register your name. Like, for example, you open an account, and then if you want to do plab exam, you just click like you want to do plab exam, and they will ask you to upload your IELTS results. So that's when you upload your IELTS results. So after you upload your IELTS results, and you ask to book for plab 1 exam, then that's when you'll find out the centers. The website will give you the options of where you want to do your exams. If you want to do it in Kenya, or you want to do it in South Africa or Nigeria, the test centers will come up, and the fees also. So basically, you are supposed to book your plab exam officially on the GMC website, not from agents. It's not something that you need someone to help you, like to pay someone so that you can book these exams. So yeah, so you can do it, and you can do it alone, and you don't need anyone's help here. So what does the exam cover? So the exam, I've already mentioned, so the exam covers the common, important, or acute conditions, those common in emergency departments, seen by trainees entering the second year of the foundation program, and the management of long-term conditions seen in the primary care. It excludes the advanced duties of a general practitioner. So when they say common presentation, I think we're all familiar with common presentation. Like, for example, an 18-year-old lady coming in with PV bleeding and right iliac fossa pain. What's your differential diagnosis? Maybe you can put it in the chat just to see you guys are following my talk. So an 18-year-old lady coming in with PV bleeding or vaginal bleeding and lower abdominal pain or right iliac fossa pain. What do you think is the diagnosis or differential diagnosis? So that's one of the differential diagnoses is ectopic pregnancy. She's a young lady, 18-year-old, PV bleeding with low abdominal pain. So you don't have to overthink. It's something which can be straightforward. Yeah. So a lady, young, with bleeding, with low abdominal pain. The first thing you want to rule out is pregnancy. So that's just an example. So it can be ectopic pregnancy. So these are type of scenarios they can test you. Okay. Next. So there will be 180 MCQs. There will be more of medicine or internal medicine questions. There will be a lot. A few of surgery, obs-gynae, peds, and orthopedics also. They can also test you psychiatry, dermatology questions, ophthalmology questions. Yeah. So very few questions will come from basic sciences like anatomy. If it's anatomy, they will just test you clinical anatomy. Yeah. So test centers, I think we have a test center now in Nairobi, and the fees is around £255. So this is not an acute or it's not a medical emergency, but it's one of the common questions they might ask you. So a 60-year-old man presents with dysphagia and pain on swallowing both liquids and solids. A barium meal showed gross dilatation of the esophagus with a smooth narrowing at the lower end of the esophagus. What's the single most likely cause of dysphagia? Yeah, I'll give you just like 30 seconds, just go through it and try to think about the answer. Because these are the things that they will test you in plab 1 exam. Yeah, just common questions, which I think you will just need maybe 3 months preparation. They are very excellent question banks online, which are affordable. So I think that one we'll talk about it another time when maybe everyone is ready to do the plab exam. I think that's the best time, not now. Yeah. So yeah, so this question, it's more the answer can be A because you just have to look at the key points. So that's gross dilatation of the esophagus with narrowing at the lower end of the esophagus. So that's atlasia. Okay, so let's carry on. Unless anyone has got a question to ask. Yeah, but its appearance, yeah. Okay, so the plab 1 exam also, it's like we mentioned, it's an MCQs exam. So this is like an answer sheet. You can see there at the end A, B, C, D, and just you use your pencil and you choose the answer. So it's something which we might be familiar with maybe when we did it in our KCPE in primary school. So it's just a multiple questions. So it's not something complicated, yeah. So plab 2 is an objective structured clinical exam or skill question. They give you scenarios, each lasting 8 minutes, and aims to reflect real life settings, including a mock consultation or an acute ward. plab 1 exam, the venues, you can do it, like there are specific venues all over the world or overseas. You can do it in Kenya, South Africa, Nigeria, Ghana. So those are the examples. Like if you want to do it in Africa, you can do it there. You can also decide to do it in Dubai, Egypt. What else? Where else? Yeah, so I'm just thinking about the countries which are near to Kenya, because you don't want to spend a lot of money maybe traveling. During my time, there was no plab venues or plab test centers in Kenya, so I had to travel to Nigeria to do it there. So you can imagine how much I've spent and the time and also the hotel accommodation there. So if you do it in Kenya, it will be much cheaper. So unlike plab 2 exam, you must travel to the United Kingdom. You must come to Manchester and do the exam in Manchester here. So yeah, so that's the difference in terms of venues. So when they say 16 scenarios, they give you scenarios in plab 2 exam. So the scenarios, they can give you common scenarios. They just want to test the clinical knowledge that you have obtained when you're studying plab 1 exams. So they want to test you now to do it in practice now in plab 2 exam. For example, they might ask you to see a patient. So it's like stations. So they've got 16 stations. Maybe one of the stations they might bring a mannequin, like just a doll, just we call it semen, and then they will ask you with this. So this mannequin, it's like it can talk. So it can tell you like the symptoms they have. So when you try to speak to them, they might even they record or they put something like a recorder inside this semen. So it can even try to express itself, like when it's having shortness of breath, you can see it's breathing quite fast, and you can comment on it, like the patient is having tachypnea or having a wheeze. When you listen to the chest, you can hear a wheeze. So so that's one of the stations. Another station, it might be a teaching station. They give you an ECG. They ask you to teach this ECG to a medical student. Other scenarios or examples are they can give you like they can ask you to break bad news. The patient may be having a breast cancer, and they ask you to break the news to the patient. And they just want to see how empathetic you are to patients and your communication skills, how good they are. So these things you will be trained. So before you do plab 2 exam, you can come to the United Kingdom. While you're still in Kenya, you can do online courses. But I would strongly advise you to do it physically instead of or face to face instead of doing it online. So it's not a so it's an exam which you're going to spend a little bit like more than you spent in plab 1 exam, because you need to travel to UK where you will need a visa. So you need a visa fee. You need flight, like you need to pay for your flight. You need to pay for your call in the UK, and it might be even maybe at least a month for you to stay here, because the course will be like 2 weeks course. And then after the course, you need to study, you need to do mocks. So you need to have like 2 weeks preparation before you sit for your exam. It's a little bit expensive than plab 1 exam. So the best advice I can give you in terms of plab 2 exam is do not rush. You must make sure that you have prepared well before you book for these exams. Yeah. Okay. So I think I've explained a little bit about what does plab 2 cover. So the exam covers everything a UK trained doctor might expect to see on the first day of foundation year. It tests your ability to apply knowledge to the care of patients, not how well you can remember and recite facts also. All the questions relate to current best practice. You should answer them in relation to published evidence and not according to your local questions of the diagnosis with exam. Training of testicular pain. We started like just a few hours ago, and they ask you to take history. So they want to see you how you communicate with patients, how empathetic you are, teamwork. That says a lot of things during that time. So they can even ask you to examine a patient. They can ask you to do abdominal examination, maybe patient having ascites, and then they'll ask you differential diagnosis about it. They can bring a mannequin to perform speculum examination, to do catheterization or IV cannulation, and semen. So that's the example that I was giving you earlier. So they want to see you if you understand what A to E approach is, like airway, breathing, circulation. It's like the way you it's in Manchester. The fees for plab 2 exam, it's much or it's more expensive than plab 1, so it's £934, and then you must pay for the training courses from your own pocket. So no one will sponsor you in terms of the courses. So you need to look for. There are a lot of courses. There are online courses. There are face-to-face courses. So you just have to do your research and see which one you'll pay for it. Yeah. So plab 2, when you're doing plab 2 or when you come to do your plab 2 exam, you'll need a visa, and it's a very straightforward application. You just have to show your booking confirmation of plab 2 to the immigration officer. And normally it takes like maybe three weeks, and then you get your plab 2 visa. So step 7 is applying for GMC registration. So after you pass your IELTS, you register or you book for plab 1 exam. You pass your plab 1 exam, and then you have to book for your plab 2 exam. After you pass your plab 2 exam, that's it. You don't have to do any other exams. You just have to apply for GMC registration. So applying for GMC registration, it has its own other requirements apart from the exam. So you must have registered with EPIC, like you must have done EPIC verification. And now it depends with which type of registration you want. If you want full GMC registration, then you must have had your you must have finished your internship in your country or in Kenya. And finishing your internship, I think you can go to KMPDB, you can ask for proof. They normally give you a letter showing that you have completed your internship in Kenya successfully. So you just have to send that to the it's not also easy to get a job. So jobs are very rare, but that interview sometimes depends with this. It depends with the individual how they apply for these jobs. So when you finish with your GMC registration and you have applied for jobs and you are lucky one and you got the job, then you're supposed to apply for a visa. So this is now a different visa. So for plab 2 exam, it's just called plab 2 visa, or you just apply for the normal standard visitor visa. But when you get a job, then you need to apply to a different visa. We call it a skilled worker visa now. It used to be called, I think, just general tier 2 visa. So it's a skilled worker visa, and it's very straightforward. Also, within 3 weeks, you just have to show a certificate of sponsorship. That means you just need to show proof that you've got a job in the United Kingdom. They will give you a letter, and this letter you just submit it to the immigration with your other application form, and you'll get a visa. Yeah. So in summary, first you complete your MBBS or MBCHB, and then complete your internship or finish your internship. Start building your portfolio. That means if you can get involved in clinical audits, presentation, CMEs, teaching, any leadership position, and whenever you do those things, please make sure you get certificates or proof, because in the UK, it's very difficult to tell someone that maybe you have been teaching medical students for 5 years without any feedback forms or any certificates. So make sure when you do those stuff, you get certificate or you get approval or evidence so that you can show it during your interviews or your when you're applying for jobs. Yeah. So do your English language or pass your English language, and then complete your plab 1 or part 1 plab 1 exam, which means that you're supposed to apply for the visitor visa sorry. So do your plab 1 exam and then apply for a visitor visa to do your plab 2 exam. Meanwhile, you can be doing EPIC verification, send the certificate to ECCMG, pay the fee, and then you get your certificate verified, and that will help you during your GMC registration. And then you travel to the United Kingdom, you do your plab 2 exam. After you pass your plab 2 exam, apply for GMC registration. After the GMC registration, you apply for jobs, and that's it. So after that, you come to the UK, you can work as an either senior house officer or trust grade or clinical fellow or junior clinical fellow. So those are different type of jobs. Sorry, it's just the same job, but they have different type of names. So I hope this talk was beneficial to maybe not, even if it's not for everyone, maybe one person from this from this evening has benefited from this talk. And if you're really interested, please, you can get my number from Yusuf. Yusuf can also guide you. I can also guide you. If you have any questions, I can give you my email address also. You can email me. And if you have any questions, please, you can ask here. Just you can either send it to the chat box, or someone can open the microphone and you can ask me directly. Yeah. Thank you very much.
Hello, Abi. How are you?
Yeah. Fine. You're fine. You're fine. Who's speaking?
Oh, this is Abdul Malik.
Oh, right. Sorry. Hi, Abdul Malik.
Hi. So I was asking, I heard that someone can do the language exam even joining before joining internship. Is that correct way, Emma?
Yes, so that's very correct. You can do your IELTS exam, you can do your plab 1 exam before even joining the internship. Yeah, if I'm not wrong. Yeah, you can do those 2 exams before even joining internship. Yeah.
So for the language exam, does it require like you have the medical degree that you've completed medical school, the language exam?
Not necessarily. No, you don't have to graduate to have your certificate to do the language exam. But the problem about this language exam is it expires. So I think during our time, it expires after 2 years. So you don't want to get stuck, because these exams, the plab 1 exam, like it's not always available. So the dates are not always available. Especially after COVID, things have changed. It used to be, so plab 1 used to be, you can sit for plab 1 exam 3 times a year. It used to be in January, June, and September. So after the COVID came, so everything changed. So at this time, it's sometimes difficult to get the date for this plab 1 exam. So just make sure when you do your IELTS, at least do it when you're in final year exam, when you're in final year. Yeah, not while you're in third year.
Okay, so and then so after finishing plab 1,
Yeah.
like how long unafaa kusubiri until you do the plab 2? Is there a specific
No.
time period?
So there's no any specific time period. So when you pass your plab 1, immediately, so it's always advisable when you see your results, plab 1 results, it's already out and you passed. Before even, if you are aware that your result will come out maybe tomorrow, you make sure you have enough money to book for plab 2 exam. You make sure that your bank account is okay and your card is working, because when you see your result, everyone will be booking for plab 2 exam. So you don't want to delay and then you miss those seats. So when you know that your result is coming out today, immediately make sure that your bank account is okay. After the result is out, you immediately go to the GMC website and you book your plab 2 exam. If you want an earlier date, but if you don't mind, then you can just wait and book wherever time you want. So my point is, if you are someone who really wants to do this exam in maybe to make sure that you have done plab 1 and 2 within 1.5 years, then I think you're supposed to do that. So pass your plab 1, book for plab 2 immediately. So when you book it nowadays, it's difficult to get an earlier date. Like you can get it after, like the earliest you can get it maybe is in 4 months time from the time you're booking. So I hope I've answered your question, but it's not easy for you to get the dates that you want, you see, and it doesn't have a limit. You can wait for I think even 2 years. You can wait to do plab 2 exam after you pass your plab 1 exam. Yeah.
Okay, so it's not something.
Sorry, Abdul Malik. Let me just add something small here. The plab, the language test is normally valid for 2 years, so it's actually safer to do this language exam when you really know that you are really ready and you're planning to do your plab 1 soon, because you'll also learn this language validity test to actually post for your GMC registration. That's one. Two, once you do your plab 1, your plab 1 will be valid for 3 years, so you can actually book for plab 2 within 3 years, but it's not advisable to wait that long. So it's better to just book for your plab 2 as soon as you have your plab 1 results. And the test dates are actually a little bit more available nowadays, the plab 1. During our time, it was a catastrophe because of the COVID. But then I think 2 years, 1.5 years post-COVID, things started getting a little bit normal. And plab 2 is actually done every month.
Yeah.
Yeah. Go ahead.
So it's something like you can plan for it, and like you plan yourself after. Before I join internship, I can do language exam plab 1, and then I wait for my results, go for plab 2. But plab 2 paka nimalize internship. It's the better way.
So unaweza fanya language exam na plab 1 exam either while you're still in internship or even before internship. And then even plab 2 unaweza kufanya tu ukiwa kwa internship, but it's advisable just to do it after your internship because it will interfere with your internship time, because getting time to come or to travel to UK, it might take even 1.5 months. So hiyo delay your internship, and then it can even affect your GMC registration later. So just finish your internship before traveling to the UK to do your plab 2 exam. So basically do your plab 2 exam after your internship. Yeah.
Okay, thanks.
Yeah. But it's not a requirement. Yeah, it's not a requirement for you to finish internship so that you can do plab 2 exam.
Okay. Hello, Doc.
Hi.
My name is Billy. I'm a medical student.
Hi.
I have a series of questions that I'd like to ask.
Okay.
First one being, what can you approximate is the total amount of money that one would incur for someone to get the full registration, covering from the plab exams and the language tests?
Okay, so that's a very good question. So I will just maybe roughly tell you about my experience, like roughly how much I spent. So I would say I've spent nearly 700K. That's what I would say I've spent. Yeah. So and I only failed IELTS once, and then I went for OET. But plab 1, plab 2, thank God I didn't fail. So that means the most expensive part was plab 2 exam. I spent almost half of that money in plab 2 exam. So if you fail plab 2 exam, then of course the amount will go up because you need to go back home, prepare again, and come back to do this plab 2 exam. So that's why I was saying you must make sure that you are ready for this exam before you book for this exam, the plab 2 exam. So at this time, I'm sure everything is expensive and it's gone up. Maybe I would say, Yusuf, please you can correct me, but it might even go up to 1 million, I think, if I'm not wrong.
Yeah, just a little bit of maybe background on this group, Abdishakur. So you are basically speaking to guys who are either number 1 or number 2 or number 3 in the country for KCSE. These are extremely brilliant people. I don't think they will fail at any point.
Yeah.
So the cost will be slightly lower because I needed to travel to Dubai because there was no test center in Kenya. You needed to travel to Nigeria.
Yeah.
So they will not have that traveling cost and accommodation or whatever.
Yeah.
So I think the cost might be a little bit lower for them.
Yeah.
It will be easier actually. So I think it should not be a turn off. And honestly, by the time you're doing your internship, you'll be able to save enough to cater for all these things without even looking for any more or any assistance from anybody. Yeah.
Yeah, I think that's I think I didn't consider that. So yeah, you can do your languages, even OET in Kenya. You can do your plab 1 in Kenya. And like Yusuf said, you guys are quite good, so I'm sure you'll pass. So just I'm sure, but then it will be less than that. It will be, of course, less than that. Yeah. And I used my money when I was doing my internship to pay for all this. So I'm sure what you earn during your internship will cater for all the expenses.
Okay, thank you on that. My second question is, here in medical school, we normally hear a lot about USMLE. So I wanted to ask you, would you recommend USMLE or plab exams for a medical student?
So that again, it will come to a personal choice. But of course, USMLE is longer and more expensive than plab route. And the advantage of USMLE is that the training. So when you finish your USMLE, you don't have to. You're not going to go to US and work as a medical officer. Of course, you'll go into training directly, and the training there is less a year compared to UK. So maybe if you want to do internal medicine, it's only 4 years, family medicine 3 or 4 years. But in UK here, when you get your GMC registration, you can also start your training, but it's quite complex. So most of the people come here and work as a medical officer first before getting into a training job. So they might work 1 or at least 2 years, and then they apply for training. So applying for training, most of the training are 5 to 7 years, except GP, which is 3 years, or general practitioner. So if I was a medical student and maybe I had that money and I had that time, because I decided to do this plab exam after I finished my medical school. So if you're still in medical school and you're considering coming to UK or maybe going to US, I'll advise you maybe to do USMLE, because the training there is quite good. That's what I've had. I don't have any experience, but according to majority of people, they say training there is much better, and it's less a year. You get, like, within 4 years you're a consultant, and the payment or your salary after you become a consultant is way much better than in the UK. So they get paid well. Yeah. So in terms of payment, in terms of time of finishing the training, USMLE is better. Yeah. I hope I've answered your question.
Yeah, you have. And my third question is, if you are to compare the payment of medical officers in the UK to Kenya, what is the main disparity in terms of the payment?
So payment, so if you're a medical officer in Kenya, I think, I'm not sure now, but it used to be almost 150 to 190 there, maybe 1,000. In the UK, you can get at least, so in terms of pound, it's from 2,500 to 3,300 pounds. That's after tax. So I'm giving you that range because it depends. If you're doing on calls, the night shift and social hours, weekends, your payment will go up. So if you don't do those night shifts and the unsocial hours, that means you're doing 9 to 5 job or 8 to 5 jobs. You're working 5 times a week, and you can get paid around 2,800 pounds. But if you do on calls, night shift, especially if you work in emergency department, you can get 3,100 there. That's after the tax. Yeah. And then there's advantage. So in terms of pound, I'm sure you guys, maybe you can use your calculator, go to Google and just multiply 3,100 with the amount when you want to convert it to Kenyan shillings. I think now it's 178, £1.
No, it's 186, and the amount's around 600k per month.
Yeah.
But that's your basic pay. Then if you do locums, you can go as high as 700k per month. Yeah.
So if you do locums per hour, you can get paid maybe £50 per hour. That's before tax. Yeah. So £50. If you do 10-hour shift, you get £500. And £500, that's like 40% will be deducted as a tax. So you might get around 260, 270 pounds. And you can locum like 2 to 3 times a month. Sorry. So I would say if you want to locum and if you work in a department where you do unsocial hours, weekend on calls, you can get around nearly even £4,000. But that means you must pay for your bills, your rent. So all those things, like it's not cheap, like it's also expensive. So you have to consider that also, because in Kenya, I'm sure the rent compared to UK, rent is so expensive. So yeah, please consider the inflation, and I'm sure you've heard from the social media or everywhere that it's quite expensive here. So
Zakayo
consider that
nini?
also, yeah.
Yeah, you have to consider Zakayo pia in Kenya. Yeah, go ahead, Billy.
So for your fare, like around 2,500 to 4,000 pounds. And
Yeah,
because of that high cost of living in UK, is that money really worth it? Yeah. Is it
so
something-
that's
yeah.
I would say thank you for asking that question. So from my personal experience, the reason I came to to UK is not like, okay, money, of course you'll get paid, but the main reason I came here is just to get a training, yeah, to get trained and to go back home and work there. You see, so everyone has own personal reasons why they want to come to UK. If you're there in Kenya, you have a good, like, you got a good training. Maybe you wanted to become a cardiothoracic surgeon, and already maybe you got your cardiothoracic job or training, and you have enough money, unaweza hustle ama uko na business job karibu yako, so there's no point of you coming here, you see. So it depends why do you really want to come to the United Kingdom. Yeah, if you want to come here because of money, I would say I think that's the wrong reason, and you should consider another option. Yeah, because you'll not get rich by coming to the UK to practice as a doctor. Yeah, I'm not sure if I'm wrong. Yusuf, you can comment on that.
Well, yeah, I think honestly, yeah, I mean, you're right. There are pros and cons that you have to look at. The most important thing is the training you get in the UK is honestly it's just world class, and once you get your certificate of completion of your training here, you can basically work in many places. That's a very good, like, is a pro, let's say. As for money, you can have your cake and eat it at the same time. You'll get paid good money here, but then you have some taxes, and then the UK is like is really big. It depends where you live. Like now, I'm in Belfast area, and you can compare whatever the cost of life here, let's say, to the cost of life in, let's say, London or Manchester or even Leicester, where Abdushakur is. I mean, honestly, I would say coming from Kenya recently, I mean, the pay is much better here. You will pay the taxes, yes. You'll have a decent life, and generally, you'll have some room to do extra things. I mean, you'll have some level of financial autonomy. Whatever I was getting paid in Kenya, and what I could do with it, and what I get paid here, and what I can do with it, it gives me a little bit of liberty to do some stuff. You understand? So I'd say pay is way better than it is in Kenya, not as much as it can be in the US, let's say, for example. But everything is just relative, and on top of it, you have good quality of life. The good thing in UK is the work-life balance as compared to the US. I think UK is much better. They're just those kind of things, like the pros and after 5 years, we get to have your citizenship if you want to become a UK citizen. If you don't want, you can get a like an indefinite leave to remain. I mean, identity card or some sort of stuff. So those are the kind of things you need to focus on. Yeah.
Yeah, thank you for summarizing. You summarized it very well. So yeah, it depends with your personal reasons why you want to come here, and there are a lot of advantages, like Yusuf said, compared to Kenya. So I'm really happy here. To be honest, I will still choose UK. Again, I will not stay. I will not stay in Kenya. So I will choose UK again and again. Yeah.
Wait, I was asking in terms of job security, what do you think? Kwa sababu currently in Kenya, most doctors ambao wamemaliza internship, they're struggling to get a job. Is it a good idea hivyo juu ya just job security.
So job security here, do you mean after you get a job and you come here, you can lose your job, or you mean getting a job, the first job?
I think I understand him.
Okay.
Yeah. So what Abdul Malik is asking is, in Kenya, you sometimes you are assured of a job once you are in your internship. Once you finish your internship, you cannot get a job with the government. Extremely difficult to get a job with private. So that's what he means. Like, he's just asking if you become a doctor and you come to the UK, you'll get a job.
Yeah, of course. If you finish your plab 2, like you've done your GMC registration and you applied for jobs, of course, applying for jobs is not easy. It's another process. But at the moment you get a job, it's guaranteed. Yeah, so it's guaranteed. I've never had any issues. Someone applying for job and then they come here, there's no job. So getting a job first, you will get it while you're still in Kenya. They will send you your certificate of sponsorship, which you'll apply for the visa. And when you come here, immediately you join the hospital or the trust or your employer. And you can change your job anytime you want, as long as you give your notice. You can, if for example, you came and you got a job in Belfast and you want to change that job, you want to go to London or Manchester or Birmingham. So you just have to go to the website, NHS website, you apply for the job. When you get the job, you just relocate. So job security here, I think it's way much better than Kenya. Yeah, and everything is contract bounded. So your employer cannot break the contract. If they break, of course, there are repercussions. And likewise, that applies to you also. Yeah.
Yeah. So I think once you come to the UK, you'll get a job. Like, there are so many jobs available, and once you have few months of NHS experience, you can basically move everywhere you want in the UK. You just look for a place, apply for it, and you move. And just one thing I've noted here, a big difference with Kenya is, in Kenya, people actually want to be employed on contract or want to be employed by the government. In this place, I have realized the guys don't even want to be employed. They want to work as locum doctors because they make like 2 times what a doctor on contract is making. Like, so that's it. I mean, it's more secure, and jobs are always available.
I think the only thing which can compromise the job security is how safe you are. That's now linked to the GMC. Like, for example, if you make a mistake, which can be applied anywhere in the world, even in Kenya. So if you make a mistake, your employer can stop you from working. You can be suspended, you can be investigated. So I think that's the only downside, I would say, in the UK. Like, if you make a mistake, unfortunately they can suspend you and they will start doing investigations. So, and I'm sure it's the same thing in Kenya, even in private hospital or government hospital. If you make a mistake, you will be investigated. So yeah, I just wanted to let you know there's also that point which you should consider also. Yeah.
Abi, you've answered my question. The main thing you can always, in terms of, like, you've saved up during your internship, and then unafanya hiyo kama investment, like hiyo pesa yako yote you invest in doing all those exams. So like at the end of it, kupata job, like guaranteed or not, like
yeah,
aspect of that.
I think I have answered your question. Right? Let me just share my screen. I don't know if you can want to change. Can you see my screen now?
Yeah.
So this is just NHS job website. Abdul Malik, can you see the screen?
Yes, I can. Lakini it's a PowerPoint.
Not the PowerPoint, the website.
I think the PowerPoint, yeah.
Not the PowerPoint.
So maybe you share the whole screen.
Yeah. Just say stop sharing and then share again. Okay. Can you see it now?
Yes, I can. Yes, I can.
Yeah. So the point I'm bringing this website is just to show you there are a lot of jobs, Yani. There's a lot of jobs in terms of your level, the level you want. If you want to apply for medical officer jobs, you can get it. If you want to apply for registrars jobs, consultant, they're always there. But the challenges comes when applying for these jobs. It's not easy for you to get it. Like if you apply size, for example, you can get it next year. There's some people who apply like almost 100 jobs, 200 jobs. Some even apply for only 2 jobs and they get the job or they get that interview. Some of them they get like 10 interviews, but none of those interviews they end up getting a job. So the point is you have to make sure that you're applying or you've done your research before you apply for these jobs. Which
Yeah. Let me just sorry.
Yeah.
So Abdul Malik, this is quite advanced at the moment. I mean, I think this should be like a discussion a topic for another day. Probably when you have done your plabs and you're applying for jobs, I can link you up directly to Abdul Shakur and myself, and we can guide you through this slowly. You understand? But the point is, there's so many jobs to be applied to, and you just send the right application, most likely you'll get a job.
Yeah. So don't worry about the jobs. You utapata tu. As long as you continue your life in Kenya, you do your if you get a job, medical officer, unaendelea kufanya kazi while you're applying for jobs here in the United Kingdom. But everyone will get a job if you apply it correctly. Yeah.
So guys, I think we should be summarizing this unless there are burning questions, because I think we're taking a little bit long.
Yeah.
So if you have burning questions, anybody can ask. Otherwise, I would like to kind of summarize. It's been an interesting talk, quite informative. I really thank Dr. Abdul Shakur, who is currently doing his training in internal medicine in Leicester, for the presentation and the time. I'd like to thank you all for attending this presentation. So Abdul Shakur, I have requested him, and he's been gracious enough to accept to act as a patron of the Alumni Association, the Health Club. So we'll have a discussion about adding him to the group to kind of answer specific questions to our doctors and medical students in the group, to be giving his advice and to be available for any consultations, if that's okay with the with the members. That's my recommendation. Just general advice, and I have been telling this to the students we've been doing medical camps with. There are general things you should have. You should have general tips for you, not just to get a job in the UK, but to improve your portfolio. To improve your portfolio in terms of getting opportunities is like being really proactive, not just reading and passing exams. That is good, but it's not sufficient. You need to participate in research work. If you have your lecturers or your registrars or anybody who is doing a research on any topic, you can volunteer to join that, maybe do some data collection or some literature review, just for your name to be to be published somewhere. That will be a really positive thing. Leadership, please don't forget to volunteer into leadership positions in the university. Like, you can vie for a position, I don't know, school representative, a group representative, maybe, and just participate to be a leader somewhere and get a certificate for everything you do. Don't forget to do your community work. I think we've been mentoring the students to participate with us in different groups, in different group activities that we've been doing. I mean, just continue with that. Have certificates of proof. If possible, do presentations, try to attend congresses, get certificates of participation. All these things are things that are just extracurricular activities that are really important when you want to apply for these international jobs, or international opportunities, or even trainings in different programs in the UK. So yeah, I hope this has been productive. So if you guys are okay, if there's nothing else, I don't know if Abdishakur wants to add a word or two, then I give it back to Abi.
Yeah, for me, it's just to thank everyone for the opportunity and for this time, for time to listen to my talk. And I appreciate everyone. Yeah, thank you very much.
Yeah, thank you very much, Dr. Ari.